Breast cancer is the most common cancer among women in this country, and new data shows a growing number of younger women are being diagnosed. Health reporter Jenna DeAngelis sat down with a survivor in Connecticut and a radiologist who explains how more people can get screened early.
Love, boundless, gratitude, strong.
For Ali Heger, this is much more than words on a canvas.
The words that she paints are really inspiring to me.
Her mother's vibrant artwork has always been a source of joy and positivity. Hoping to have that impact on others, she worked with her mom, Kerry Rosenthal, to turn her art into a lifestyle brand.
These are just the best little happy reminders that everything's going to be okay.
Working at their Westport store has always been a bright spot for Heger, but it was here she faced her darkest moment 3 years ago.
So I was actually in this room, sitting in this chair here, when I got the My Chart message.
A breast cancer diagnosis at 30 years old.
At 30, it's like you're not thinking cancer and like mortality. I was thinking about meeting the love of my life and like starting a family. I did have a moment where I was like, I don't think I can fight, and it took a lot of people kind of emotionally even thinking about it, but it took a lot of people kind of rallying around me and saying, like, you have to fight this.
It all started when Heger felt a small lump. She went to Norwalk Radiology Consultants to get it checked out.
This is exactly where she felt the abnormality.
Dr. Mia Kazanjian says Heger is part of a concerning trend with breast cancer.
We've seen more and more patients in the 30s, so the millennial generation, and then even some in the 20s.
What she's seeing is supported by statistics recently released by the American Cancer Society. During its most recent decade of data, 2012 to 2021, the rate of breast cancer rose by 1% each year, with a steeper increase among women under 50, 1.4% annually.
I want people to know that yes, the face is changing. Younger people are getting cancer. But what can we do about it? Screening is certainly key.
That's why, despite 40 being the recommended age to begin annual mammograms, Dr. Kazanjian is encouraging screening sooner. Connecticut and New York have laws which require most health insurance plans to cover a single baseline mammogram for 35 to 39-year-olds.
Hold your breath.
Information that empowered me to get my first exam.
As a radiologist, I want to find a cancer, Jenna, when it's this big, when it's 1 millimeter in size. The main way to think about breast cancer is the earlier you get it, the better the long-term survival, the better the outcomes. So this machine is taking images in an arc around the breast.
The doctor turned patient to show us what a 3D mammogram looks like.
Some people can have some discomfort during it, but it's very short lasting.
As well as an ultrasound.
When you have dense breast tissue, it's sometimes difficult for the mammogram to pick up certain things which ultrasound may be able to pick up.
The radiologist recommends every woman take a breast cancer risk assessment test, which is available online for free, and review results with your doctor.
Women that have breast cancer, a genetic component, or it runs in their family, are able to get screened at younger ages.
Lena Aguilon with Susan G. Komen says while white women are more likely to get breast cancer, there's a higher mortality amongst black women.
Unfortunately, we think it's an access to care issue, and Komen is making sure that people have access no matter the age or demographic.
Heger also stresses the importance of self-breast exams. After treatment, she is now cancer-free. Focused on spreading awareness with her mom, who found new purpose in her painting.
She painted the original of this very shortly after I got diagnosed. It's just a blip. So her idea was that it would be just a blip in the grand scheme of a very long and beautiful life.
A portion of proceeds are donated to nonprofit Pink Aid to help underserved breast cancer patients.
What is your overall takeaway just from the last 3 years, everything you've experienced and where you are now?
That life is such a gift. If you have your health, you have absolutely everything in this world.
In Westport, Connecticut.
Love you, Mom. Couldn't have done it without you.
Jenna DeAngelis, CBS News, New York.
And the doctor stresses that there are lifestyle factors that impact risks, such as drinking alcohol, smoking, obesity, and living a sedentary lifestyle. This is an issue very close to our hearts here at CBS News New York. On Sunday, September 7th, our news director, Sarah Burke, will be co-captain of the Paramount CBS team at the 2025 Komen Greater New York City Race for the Cure in Central Park. And we hope to see you there.